When you're given a form to fill out at your doctor's office, the questions are usually about medical issues, family history of illness, or medications. But now, some doctors are asking questions about jobs, where you live, or even if you have enough food to eat. That is because your zip code is a better predictor of your health than your genetic code. In fact, the social and economic factors where you live and work contribute in the most powerful way to your health.
Prior to coming to the U.S., we lived in a refugee camp for about 7 years. My family, decided to come to Massachusetts, and we were struggling to speak the language, but we were getting help by a Somali interpreter that was at the health center. That was just an amazing thing, just to have somebody, advocate for you. So the mission of CCHI is not just to help an individual or a family, is pretty much to help the whole community. And at the end of the day, that community is your family.
Hello, everyone. How you guys doing?
Good, how are you?
I'm Yahaya. I don't think we haven't met, right?
Yes.
Have we?
No, we haven't.
Hey, I'm Jim.
Jim, I'm Yahaya.
Nice to meet you.
Nice to meet you. Likewise. This is it, huh?
Let's take them off. My name is Jennifer BERMUDEZ, but I like to go by Jenny.
Yeah.
I grew up in Chelsea, still live in Chelsea now. So I started the youth programs when I was a junior in high school. I've always wanted to be a nurse. Financially, they helped me, college preparedness. I got a internship on White 10 at Mass General Hospital. I graduated nursing school and I got hired as a nurse on that floor. It's unreal to think that this is where I'm at right now, like coming from where I came from and then now I'm here. The youth programs definitely set me up with that, because if I didn't get that summer internship, I wouldn't have gotten that job. One of the biggest things that stood out to me during COVID was how so many Spanish-speaking people were getting COVID, and I did some time at the Revere Hotel providing Spanish-speaking services.
We come from 20 different countries, speak 22 different languages. And I think just sharing a lot of key life experience, because a lot of them has lived through a lot of stuff that the patient had lived, is very key. My name is AIDA VIZCAINO. I work in MGH Chelsea. I'm part of the community health worker team. They're worried more about the social determinants, such as affordable housing, getting access to healthy food, the lack of education, or because they speak another language. We get to know more the patient, meet them where they are, and address all the challenges and barriers.
I'm a primary care doctor at Charlestown Health Center, and in 2004, the big thing that was happening in Charlestown was the opioid epidemic then. A few years later, we started to really work together a lot more. The coalition would be there, the peer support, recovery coaches would be there, doctors, nurses, community health workers, clinicians, therapists, psychiatrists. Big room full of people to talk about what was going on with the patients. It was a light bulb to realize how much more successful it was when we worked with the coalition. You're kind of trained to do your work inside the office or the hospital or the health center. It's very humbling to realize that that has, 20% of the impact that you need to have, that the other 80% it's got to be the view from outside the health center.
I mean, there's a lot of work to be done, but at the same time, the work that everybody's doing, like it's helping make our people safe and our city safe. So, thank you.
Great conversation.
That was a
Yeah,
great
it's
conversation.
great. Thank you guys.
Thank you. It was really nice.
Thank you.